Most women will suffer from a urinary tract infection such as cystitis at least once in their lives. Currently, doctors often prescribe antibiotics, but such drugs aren't necessarily the best way to deal with these illnesses.
So urine infections are very common, and more than 90% of the time, if you go and see your GP with cystitis, you'll be given an antibiotic to take away with you. We know that of the women that go and see their doctor with cystitis symptoms, only 6 out of 10 even have an infection in their bladder. There'll be other causes of very similar symptoms, inflammation in the bladder, but not a bug there. So those women probably don't need antibiotics, and we also know that even women with a bug in their bladder, they'll often get better over the next 4 or 5 days without any treatment at all. The trouble is, as you will know if you've ever had a urine infection, it's terrible. You feel awful, you're going to the toilet all the time, it burns, you might have discomfort in your tummy, lower tummy pain, so you feel pretty terrible and you really want something to help with your symptoms. And if the doctor said, well, if you put up with this for 4 or 5 days, it will go away on its own, you're probably not going to be very impressed. So what we're trying to do is say, well, there are probably other ways of dealing with the symptoms. One of the treatments is called bearberry, it's the leaf from a plant. It's called bearberry because the berries are eaten by bears. And it's one of several herbs which have been used in traditional herbal medicine for urinary symptoms. We really want to know whether this will make a difference. So that's the trial we've set up, which has been funded by the NIHR, which is the National Institute for Health Research, so publicly funded.
The trials are taking place in Oxford, Bristol and Southampton, with GPs needing to recruit 330 women to take part in the study.
We have a plethora of patients who come in every day in our area with urinary tract symptoms, and they don't all necessarily need to have antibiotics. So this is an amazing trial because I can actually offer them something else apart from antibiotics. We live in a very educated area here, and lots of ladies say, oh, I really don't want to have antibiotics. So the reason we've been so successful here is because most of our patients don't actually want an antibiotic, but they don't want to carry on with the symptoms they've got. And I think the biggest help has been letting them know they can still have an antibiotic, which we ask them not to take unless necessary. But as soon as I say I will still give you a prescription, they're not so worried about partaking because they know if the symptoms get worse, they've got that help there, rather than then having to get an emergency appointment.
Some 30 women have joined the trial in the last month, so it'll take about 6 to 10 months to get the full figure across the 3 centres. Rebecca Pullen agreed to take part in the trial when she got a suspected case of cystitis.
So we discussed the options basically. I could have some antibiotics, or I could take part in this trial in which I would take a tablet, 3 tablets 3 times a day for a week to see whether the symptoms resolved, but also they would give me antibiotics, so if the symptoms got severe, I had the backup of a treatment that should hopefully clear an infection. And I thought it was important. The medical world is developing constantly, and if people don't agree to do trials, then nothing's going to move forward and no alternative treatments are going to be found.
There's growing concern from the medical community that bugs are becoming resistant to antibiotics. But are doctors being alarmist?
I don't think it is scaremongering. There are very few new antibiotics being developed, so we have to make sure the antibiotics that we have now will last well into the future. The bugs that we're treating are very adaptable and they develop resistance to those antibiotics. That's something that's built into the way they are, into their genetic code. And so if you use antibiotics a lot, the bugs will develop resistance to them. It just happens. And the only way of limiting that is either to invent new antibiotics, which isn't happening at the moment, or to say, well, actually we need to be a little bit more careful with the antibiotics that we have got and make sure we use them when they're really needed in people with serious infection.
The researchers hope they'll be able to start analysing the data next year, so we could know if these herbal remedies are effective at dealing with urinary tract infections as soon as next autumn. Briere-Edney, that's Solent.